Hello everyone, I'm Dr. Preeti Sharma, Senior Consultant Pediatrician from KIMS Hospitals, Hyderabad. I had a great time chatting with Vishu and Duju, and I love their content and their show, Taking It Slow, the podcast. So please like, subscribe, and follow them. Thank you.
It's another Sunday. You know what that means. It's time to take it slow. और विशु क्या हालचाल?
यार बहुत ही सही हालचाल है मेरे तो अभी तक, लेकिन इंडिया के हालचाल सही नहीं लग रहे हैं। वापस से कोविड आने लग गया और अभी तक हम ऐसी हेडलाइंस सुन रहे थे कि हाईएस्ट नंबर ऑफ केसेस इन दिस ईयर, हाईएस्ट नंबर ऑफ केसेस इन दिस ईयर, बट नाउ हेडलाइंस हैव चेंज टू हाईएस्ट नंबर ऑफ केसेस
Every day we are breaking a record.
मतलब मेरा एक बहुत ही अजीब सा ऑब्जर्वेशन था इसमें। एंड अगर कोई मतलब राइट विंग बंदा सुन रहा हो तो उसको, एंड मैंने ये डिस्कस करा राइट विंग बंदों के साथ, मतलब अपनी फैमिली के साथ, एंड दे हैड दे हैड ऑपोजिंग व्यूज। तो मतलब जब ऐसे तबलीगी जमात के लोग थे, कितने लोग थे वो, 300 लोग थे, एंड उनका मीडिया कवरेज हुआ था कि भाई मानव बम हो गए हैं ये और ये हो गया है, एंड नो मीडिया इज कवरिंग दिस, बट कुंभ मेला इज गोइंग ऑन राइट नाउ, जिसमें हर रोज लाखों लोग, मतलब टोटल अटेंडेंस करोड़ों में होती है उसकी।
बट योगी जी संभाल लेंगे ना वहाँ पे?
उसमें यार मेरे को ऐसा लगता है कि क्योंकि गंगा जल सारे
पवित्र, सब पवित्र कर देगा। अरे तू कुंभ मेला छोड़ भाई, इतनी पॉलिटिकल रैलीज चल रही हैं हर जगह पे, मतलब
एग्जैक्टली। मतलब फिर मेरे को लगता है, पता है, एक बार मतलब आई फील इट इज सो फ्रस्ट्रेटिंग, बट देन आई फील जो पॉलिटिशियंस है ना, दे डिजर्व इट, कि वो इतनी पावर वाली पोजीशन पे पहुंच गए हैं कि अब कॉमन मैन का वो कुछ भी करते रहें कि भाई तुम्हारा रात को 9 बजे बंद हो जाएगा। सो दे, अब इसका नाइट कर्फ्यू आने लग गया है कि नाइट कर्फ्यू होगा, एंड इसकी प्रैक्टिकलिटी सोचो, रेस्टोरेंट बिजनेस वैसे ही इतना मुश्किल होता है, एंड इट्स लाइक 10 बजे कर्फ्यू है, सो रेस्टोरेंट्स आर क्लोजिंग एंट्री एट 8 PM, और उनका तो सारा बिजनेस ही रात का होता है,
पोस्ट 8 PM होता है, वीकेंड्स पे बंद है।
दे हैव, मतलब इन लोगों का अगर तुम्हें बिजनेस मारना है तो हाँ चलो लॉकडाउन सही है, लेकिन पॉलिटिकल रैली करनी है तो ही कोई लॉकडाउन नहीं है, कोई नाइट कर्फ्यू नहीं है, कुछ भी नहीं है।
प्रॉब्लम इस कोई समझता नहीं है इसको।
पता नहीं यार, समझते भी है लोग यार, लेकिन कुछ मतलब जो लोग, सब लोग समझते हैं, बट द पीपल हु आर इन पावर, वो जिनको जो जैसा उनको बेनिफिट करता है वो वैसे डिसीजंस लेते हैं।
But what about people who vote them to power?
They are coming to their rallies.
Fair.
Yeah.
So this is not a political podcast. This is not
yeah.
This is not a podcast where we are trying to lean your mindset towards either side. It is just sad state of affairs. Anyways, to analyze this sad state of affairs further, we have an in-house expert today. We have someone who is dealing with this situation firsthand. Over the last year or so, I have gained the most respect for doctors, especially from the frontline doctors who have been dealing with patients, dealing with COVID every day. And we have one such Dr. NR Mitz on the podcast. And it was also a very informative session in ways that we did not want to be informed about. So, but that is a surprise for you as well. Without any further ado, let's dive right in, people. So on a very pertinent topic, we have a very special guest with us today. We have a senior consultant pediatrician from Hyderabad. We have none other than Dr. Preeti Sharma joining us on the Taking It Slow podcast. Hi, Dr. Preeti, how are you?
Hi, Duju. Hi, Vivek. How are you guys doing?
All good, all good. क्या चल रहा है यार?
Awesome.
वहाँ पे कैसा सीन है अभी?
बस कोविड का सेकंड वेव चल रहा है।
क्यों चल रहा है कोविड का सेकंड वेव? क्यों चल रहा है?
We really don't know. None of the scientists know. So there was this big debate कि इंडिया में second wave क्यों नहीं आया, and Indians were very happy that because we remain not so hygienic as the Western counterparts, so we are doing great. And that time scientists were baffled why we are not getting COVID, and now scientists are baffled why suddenly we are getting COVID. So I guess COVID is something nobody is able to figure out. So Mumbai, you are in the favorite hotspot of COVID, no? Mumbai is
Mumbai seems to be the worst hit. And अब ये नया शुरू हो गया. There is an outage of vaccines now, and कई जगह मुंबई में we are almost out of vaccines. There are a number of other places also where we are apparently out of vaccines. थोड़ा सा mismanaged लग रहा है क्या वापस अभी?
See, vaccines, this is just purely out of my experience, not that I know exactly the data, how many vaccines are being manufactured. So when the senior citizens vaccine was announced, so I took my in-laws for vaccination in Hyderabad, and my parents went for vaccination in Gurgaon. And it was very smooth. Minimal line thi, thode bahut log the, and they got the vaccine easily. Now, both of them were due for their second shot. And this time when I took them to my own hospital only, at 8:45 a.m. in morning, matlab Hyderabad mein nobody comes before 10:30 even to the hospital.
Yeah.
There was a big queue. So I realized suddenly that time I think people were very relaxed. Ki, theek hai, abhi to there are hardly any cases. But now with the cases going up, everybody is queuing up for vaccination. And same feedback I got from my parents also who are in Gurgaon. So I think suddenly more people are signing up, and maybe the government didn't anticipate this kind of demand. I really don't know. But on one hand, we are sending Covishield out of India, so really tough to say what's really happening. And Serum Institute is saying it is capable of producing vaccines. I don't know where the break is happening in the supply chain demand. Either the transport is not happening. Difficult to say.
एक पॉजिटिव साइन भी हो सकता है ना कि मे बी जब आप पहली बार लेके गए थे तो पीपल वर रियली अवर्स टू टेकिंग वैक्सीन
That's what I'm
के
saying. Now more people
या
want the vaccine, so इसलिए अब shortage हो रही है. My personal opinion, but फिर भी shortage नहीं होनी चाहिए थी because we are the ones manufacturing in India.
We are
And
exporting it to a number of other countries as well. We are gifting
exactly.
vaccines to a number of other countries.
Yes. And we are getting the Russian vaccine. So I don't know. I really don't understand that. But both the vaccines are very good. Both Covishield and Covaxin are showing very promising results. And literally, we are now piggybacking on them to tide over this wave. Let's hope for the best.
So there are a number of other theories as well कि कुछ अलग mutated version आया है virus का. हाँ, I have absolutely no idea, and you are the expert here. So tell us more about that.
So there are a few mutations being reported, but whether they are responsible for this outbreak, they still can't say as of now. Pune mein ek do mutations hain. There are some mutations reported from Punjab, but as such, these viruses mutate very fast. For example, the swine flu virus, the flu vaccine is also made every year because there are some mutations. But I don't know, like such drastic mutations to cause such widespread COVID. Difficult to say really whether the mutations are behind this. I hope not. Otherwise, the vaccines will again have to be, redone if it's a major mutation.
That's what I was coming to. So, from what I understand, these vaccines have been developed keeping this strand of the virus in mind.
Yes.
Now, if the virus starts mutating, we might need another vaccine altogether, which is a cycle that can go on and on and on.
Which will
but
anyway
minor
need
mutations should not make a difference. Like Covishield, they are claiming that they are effective against the UK strain as well as the South African strain. They are not effective against the Brazilian strain. And Covaxin, they are saying it can handle all mutations. So that's why suddenly now people are taking Covaxin. In the beginning, nobody was taking Covaxin except HODs of AIMS and all few political leaders, including Mr. Narendra Modi. But now suddenly everybody wants to take Covaxin. So in a way, it's good because that is showing 80% effectiveness. Good.
What do you mean by 80% effectiveness?
That 80% of people who will take the vaccine will be protected against the disease. But what the studies are saying, even if you get the disease, those who are vaccinated are getting the milder version, or at least they are not getting hospitalized or the severe form, which we are worried about. See, simple fever, cough, cold, we get so many times. At least me being a pediatrician and children coughing literally on my face, I used to get fever, cough, cold 3 to 4 times a year, severe, high-grade fever for 2-3 days. So that is doable, something which you can manage at home. So what we are worried in COVID is the hospitalizations, oxygen requirement, ventilation. So if vaccine can avert that, great. That's good enough, I think.
Why are there no vaccines for children?
Because the trials have not been done in children yet. So I think Pfizer has started trials in adolescent age group, and they are saying the results are very good. And children got very mild COVID in the first wave, but surprisingly in this second wave, we are seeing children being slightly more affected. अब इसके दो reasons हो सकते हैं. एक तो maybe the virus has mutated as we were discussing. Secondly, now parents are not able to keep kids under check. You know, they are like, okay, खेलना है खेलो, you want to go out, you want
बहुत
to
हो
hang
गया
out with
हाँ
friends. So maybe I think now they are getting properly infected. But yes, children are more infected in this second wave, and they are getting slightly more severe disease as compared to the first time round.
Dr. Sharma, you were also talking about the preparedness of the hospitals
Yeah.
uh, in this phase compared to the first phase. How do you compare the two? Previously, we were fighting a race against time. We wanted to delay the outburst as much as possible so that we could
flatten the curve
flatten the curve. We could
Which
delay
never
the
happened.
which happened for
Yes.
a while, but then obviously it is
Yeah.
spiked again. Is our medical infrastructure better prepared this time around? You are a key member of our medical infrastructure, so what is your opinion?
So maybe, I don't know in terms of infrastructure, like whether new ventilators were added, whether new beds were added. I'm not really aware that from the government point of view. But in terms of doctors being more aware, yes, now doctors are definitely more aware. That much fear is not there. Like in the
exactly
beginning, like right in the beginning, I used to read every day, okay, now what has changed in the management, what to see in a child, because we had never seen this disease. Similarly, in adults, so many things came up. There were some clotting problems, bleeding problems, some neurological problems. So now, at least once you know what are the set complications, it's easier to look for those. And doctors are more comfortable in treating these, people now, with COVID, and they can identify the risk factors earlier, when to use remdesivir, when to give steroids. Those guidelines are much more clear. So yes, if you have to pick whether you should have fallen ill in the first wave or the second wave, somebody would always pick the second wave, because at least doctors know what they are doing now. Pehle that was one experimentation. One day you're giving doxy, one day you're giving hydroxychloroquine, one day you're giving ivermectin. Every day one new drug was like the golden drug against COVID. So yes, that way things are more streamlined. Infrastructure, I still feel, is lagging. Mumbai, there are no beds. I like my Mumbai. I did my MBBS and MD from Grand Medical College, Mumbai. So in my group, we are a group of doctors. Still, I find every day somebody is messaging, can somebody arrange a bed in this area? Do you have any contacts in this area? So if doctors are struggling to get beds for their near and dear ones, so you can imagine the situation for the common man. And just now I got a message from my hospital management, no more COVID beds now. Any COVID patient coming in the night has to be sent to some other hospital. So in Hyderabad also, even though my hospital is like 250 bedded, not like a very, very big hospital, but still we had close to, I think, 100 dedicated COVID beds, and they are all full. So yeah, the situation is worrisome.
So
A
what
bed
happens
in
like if
everything.
हाँ मतलब बेड मान लो पूरे हॉस्पिटल के फुल हो गए लाइक इन अ सिटी व्हाट इज द लास्ट रिजॉर्ट क्या होता है फिर मतलब घर पे जाओ वापस
I really don't know. I think government hospitals somehow manage it, because I think government hospitals can't turn away patients. So I think एक photo भी आया था मुंबई में. There were 2 patients of COVID lying on one bed. So I hope we are not reaching towards that.
Yeah, to CN is
Or they can come up with
very
some
bad.
innovative measures. Like I remember in Delhi, they made some stadium into a COVID ward or something like that. Something like
Yeah,
that.
yeah.
Hyderabad, they did not reach that levels last time. Now I don't know about this time, so I think we'll have to come up with some situation. Like there was this plan to make the railway coaches into
Railways,
beds.
yes.
ऐसा कुछ तो करना पड़ेगा. But problem ये हो रही है, the healthcare workers, the nurses, the staff, they are also falling ill. So there is shortage of manpower. It's crazy, yeah.
यार लेकिन मतलब अभी फिर से वी हैव रीच दैट लेवल लेकिन अभी फियर उतना नहीं है जितना पहले था ना बिकॉज अर्लियर
हाँ,
थोड़े से भी
वो
होता था
fear
बहुत फियर
of
होता था
unknown
लेकिन
होता है ना, fear of unknown होता
हाँ
है. अभी अपने circle में you know someone who has been through it. It is very highly likely that somebody or the other, through your friend's friend, you will know someone who has been affected by COVID. And obviously there are adverse cases, but there are a number of positive stories as well of people who have come out of COVID who have not been that severely affected. So एक थोड़ा सा उससे भी mental confidence आता ही है कि हाँ ठीक है, we'll get through it.
Yeah, and 90% of the people do get better. Matlab, they may have long-term weakness and all. It's the 10% who land up on oxygen or ventilator. They are the ones who are the big sufferers, and the huge hospital bills. So that is, I think, really, a problem.
Yeah, we are from a medical family. That's why we have smiles on our faces while saying this. Like people who are not from medical families, who huge
No, so I
hospitals,
tell you,
they
when
सुन के
COVID started and the bills were like, we could hear. So first, our hospital was not taking COVID cases. So first, the government, if you remember, only government
yeah,
hospitals were
yeah,
allowed.
Designated
Then
hospitals were there. Yeah.
certain private hospitals were allowed. So then the first thing I told my husband was, please top up your insurance policy. So he actually topped it up by 25 lakhs because we can't take a chance. And then
yeah,
I went to my, our hospital medical superintendent and I told him, I'm seeing all these COVID cases, but what if COVID happens to me? And they were like, no, we'll take full care of you. Then I was like, okay, fine, let's just go ahead. At least, we should get a bed if something
yeah.
happens. So that
Mm.
fear is still there, but okay. I think even the costs the government has streamlined now to an extent. The charges have been brought down. So
हाँ, और अब यार हमारे
something
पास वो
better.
भी है, like we have solutions for it, like we have coronel now, और अब हमारे पास कुंभ मेला भी है
हमारे
अभी
पास डाइल्यूटेड गौमूत्र की दवाइयां भी बिक रही हैं भाई.
तो इसमें भी फेयर करना है थोड़ा.
One tablespoon of gaumutra in hot water every morning. It is a proven cure.
Randomized controlled trial.
Yeah.
You saying that we are slightly better prepared as far as the manpower is concerned because they've been through it now.
Yes. Mm-hmm.
बट स्टिल यू मस्ट कम अक्रॉस पीपल जो अपने फोन में गूगल खोल कर ये आते हैं कि हाँ मेरे को तो देखो यही है, गूगल के सिम्टम्स के हिसाब से मेरे को तो यही है. हाउ डू यू डील विद दैट? एंड दिस इज नॉट अ फिनोमेना जस्ट लिमिटेड टू कोविड. ये तो मतलब मेरे खुद के घर में होता है. अगर वाइफ को हल्का सा हेडेक है तो मेरे को तो बस ट्यूमर हो
Cancer है.
गया. ब्रेन ट्यूमर है. ऑब्वियसली ट्यूमर है. मतलब इससे छोटा कुछ है ही नहीं. सो इज दिस अ फिनोमेना दैट you've seen on the surge of late over the last few years, 2-3 years?
Yes,
And
yes. It's
how do
getting
you
worse with
deal with this?
every passing year, and how to deal with it, I can only tell them, please don't trust COVID. I mean, sorry, Google. Sorry, everything is COVID these days. So please don't trust Google. They have years of experience to guide you, but still you can't help it. I remember when COVID was just starting. So one patient took an online consultation with me. And his child had mild cold, cough, and some fever was there. And even somebody else in the family had fever. So I told him, get the child tested for COVID. He actually fought with me that there is no fast breathing. I have read the symptoms. What rubbish you are
Nice.
doing. And I was like, you don't want to accept, you don't accept. I just disconnected the call. And then he sent a message. So it's a app for online consultations saying that this doctor should apologize. She does not know the symptoms of COVID properly. It was like hilarious. So that is how some patients are. Like, he was like, no, there has to be breathing difficulty. My child has no breathing difficulty. How dare you suspect COVID? So yeah, we get all sorts of crazies we have to deal with. But most of the patients, once you tell them, no, don't rely on Google and we are there, we will guide you, then they do understand. And because of this misinformation, actually, I decided to make a small short videos of my own for my patients' information. So somehow, if I tell them, they are less convinced. But if I'll send them a link to my YouTube video,
And then they are
will
convinced.
be like, okay,
Internet पे है तो सही
saying the
होगा.
same thing here. So it reinforces what I told them in the OPDs. And especially during COVID, I found a huge problem because all parents were without grandparents. Now, whatever the problems you may have with your in-laws, they do have some traditional wisdom.
Yes.
I was surprised patients came to me, and for my mother, I remember when I was a kid, of course, she was not a doctor. And even with fever, the first thing she used to do, like, "Arey, pani ki patti kar do, do sponging. That will bring the fever down." And here I had patients, and they're like, how to do sponging, what water to use, what cloth to use, how much time to use. And I'm like, "Arey, there is no grandparent at home. Yeah, they'll do it." And they're like, no, in COVID, nobody's there. So in COVID, really, some new parents with just small babies, they really struggled because
Internet has been a bane in this case. मतलब patients आते हैं कुछ भी information लेके, but it must have had its positive effects too, right? जैसे आप reach out कर सकते हो patients को, and there are other apps now. Practo आ गया है. There is 1mg, Pharmacy, जो भी है, मतलब doctors के लिए जो भी apps हैं. So do you see any positives of net? Like, do you experience them right now? या फिर in future?
See, I am I was really not a very tech savvy person, but with changing times, I guess we also have to change. So I realized this is a better way of communicating with patients, reaching out to patients, sending a message. So yes, it does work that way, but it has a huge downside also, especially all these, I don't know about 1mg so much, but Practo mein to don't like a doctor, give a review. And it's like we have
Oh my
become
God.
like some restaurant service, and it is so demeaning. And immediately, so if 10 patients are
Yeah,
happy with you, they'll not put a review. One patient
exactly.
is unhappy, it will be like such a horrible review. And people see those reviews and come. So your presence on the net has become important, and it's become a necessary evil. So for that reason, I always dislike Practo. I think Practo
So,
started a trend of giving reviews for doctors. Before that, it was just some lame Google reviews or something like that.
and I can completely resonate to what you're saying.
Yep.
So I had to get a tooth procedure done,
Okay.
and
Mhm.
उसके लिए the first thing that I went to was Practo, because हम लोगों को
Hmm.
तो ऐसे आदत नहीं है ना कि हम लोग अगर घर पे होते हैं तब तो उठ के किसी के पास चले गए.
फैमिली डॉक्टर होता है, हाँ.
फैमिली हमारी पूरी फैमिली ही
Hmm.
डॉक्टर है, तो उठ के किसी के भी
हाँ.
पास चले गए तो वो खुद कर देंगे जो भी है.
Hmm.
If you're living alone, then the only thing that you can rely on apparently is Practo. And उसके बाद I also
Yes.
got into that habit of reviews कि हाँ इसके
Review.
reviews 4.7 इसके 4.8 है तो मैं इसके पास जाऊंगा.
Yes.
So that it is actually true. And does that put a lot of pressure on you as well? How to maintain a good Practo profile or good social profile now?
I guess it is there, though I am probably a decade behind. I never really bothered about these things till maybe 1 or 2 years back, because so most of the patients see the best publicity or the best marketing for a doctor is word to mouth.
Yeah, right.
One patient is happy, he'll send 10 relatives, 10 neighbors. So that is the best thing. But yes, these negative reviews do hurt you. And then I think to compensate, you need to have positive reviews. And there are few doctors who are really good at that. They'll subtly tell their patients, please a review dal dena. I can never do it. So I'm like,
Yeah.
okay, fine. I find it like, I didn't become a doctor to do all this. But but it's become a necessary evil. That's all I can say. So if you at the end of the day, doctors have become like a product which has to be marketed, and unfortunately, that is the
Yep.
situation. वो पहले ज़माने जैसी बात नहीं है. वो गली के शर्मा जी को दिखा लीजिए. He's a very good doctor. That is no longer there, and I think one reason is because people are shifting so frequently. Now, if like 3 साल
True.
Mumbai में है, 4 years
Yeah.
they're in Hyderabad, 5 years they're
Yeah.
in Delhi. So how will the patient also come to know? So I guess in a way, it's okay, but then it's important for you to be there, and that's what somebody told me. So once I got a bad review on Practo, and I was very upset because it was a person who actually misbehaved with us, and because it was a very busy OPD, I didn't call the police, but I was literally about to call the police, and he misbehaved with my female nurse, and it was all on CCTV recording. And he put it up on the Practo profile. So I called the Practo people, and I was like, I can show you the CCTV footage. It's it's a bullshit review. He's just faked it up. And they're like, no, ma'am, but how can we remove his side of the
Customer
story?
is king.
I have proof on
Customer is king,
CCTV,
ma'am.
and they are like, no, ma'am, how can we remove his side of the story? Then, to cover that up, I told my nurse, 5-6 patients, if they are happy, please ask them to give, reviews. So
Yep.
we had to do that. And
Damn.
then I wanted to remove my profile, but then somebody told me, just because you'll be absent from Practo, that's not, or from, say,
Yep.
the internet, you don't exist, that's even the worst thing to do. I mean, so you have to be there. So there'll be some negative, some positive. Now I don't bother.
Yeah.
In purely marketing terms, I always felt that this is a profession where the product will be king. So हम लोगों के यहाँ पे होता है कि either get the product right or get the campaign right. There's a theory that a good product does not need marketing.
Not true anymore, I guess.
It will sell on the basis of its
Yeah.
quality itself. I always felt that this is a profession where the product will always be king, because it is a matter of people's lives and death. It is a very high involvement category. If I'm completely going into the marketing domain now, it is a very very high involvement category. And यहाँ पे तो product ही बोलता है, and उसमें भी अगर आप बोल रहे हो that there is pressure to maintain a profile, maintain a good social profile on Practo. Practo is what people go by now.
Practo, Google reviews or anything, yeah. Somewhere like earlier, even our hospital never bothered, but I'm noticing since the last 1 or 2 years, the receptionists have been trained. that the
Yeah,
patients,
yeah,
to ask them, please give us a Google review. So, I mean, I still find it very hilarious. But I don't know. I guess the hospital needs it because all other hospitals are doing
yeah,
it. It's become
yeah,
like,
yeah.
Yeah,
up the race,
yeah,
how can you not do it? So, it's
yeah.
become that
ये
It
तो
is a
फिर
race
भी
now. It is a race
ये तो
now.
फिर भी
हाँ.
एथिकल प्रैक्टिस है. आई एम प्रीटी श्योर कि बहुत अनएथिकल प्रैक्टिसेस भी शुरू हो जाएंगी. लाइक देयर विल बी बिजनेसेस who reach out to doctors that you give us money and we'll give you these many positive reviews.
So
कि
that does happen, and I don't
yeah.
want to comment about it on this, but that does happen. So yeah, so yeah, sab hota hai.
Doctors are in the
Like,
market now, yaar.
yes,
And
unfortunately, when
is
I
there
did
a
my MD, I used to feel so proud कि आप profession choose किया है, and now I'm like, okay, we are like, yeah, anybody
Yeah,
else.
yeah, MBA
is there a
वाले.
lot of competitiveness as well amongst the fellow doctors themselves?
Not so much. I think the competition is more between the hospitals per se. Like if there are two big hospitals, so their marketing
Hmm.
teams will be trying to vie for the same things. Not so much between doctors, but of course, see, there will be some competition if X is doing better than Y. And problem kya hoga na? Like our statistics will come. India has shortage of so many 100,000 doctors, but in
Hmm.
reality, all the doctors are in the big cities. And the
Yeah.
short now you'll say you can also go and work in a village. So okay, I won't criticize doctors for wanting to be in a big
नहीं नहीं
city, but
that's fine.
this data comes because of the villages and the smaller cities and the smaller districts. But overall, in the big cities, have plenty of doctors. There's so many super
Yeah.
specialists, you name it, and it's there. So obviously,
Hmm.
competition is bound to be there. But the main type of competition is between the hospital chains, not so much between doctors. And especially after a few years, no, you tend to have your set clientele of patients. And if you are not like
Hmm.
overly ambitious, you are somebody like me. So I'm happy seeing my X number of patients every day and then giving some time to my daughter and at home. So yeah, fine. Then it really doesn't bother you so much.
You were just talking about your daughter. Your expertise is in the children area or the younger age.
Yes.
Speaking solely from their perspective, lockdown has been difficult for everybody, but has it been severely difficult for them? Because if I look at us growing up traditionally, this is the age where going out is very important. Getting exposure to the outside world is very important. Mingling with other people is very important. That is how your personality develops. This is the most impressionable stage in the child's life. Children have been locked down behind doors for almost a year now, and it looks likely that this will be the case going forward for another 6-8 months at least. How difficult has it been on them, and how much impact is it likely to make on their lives, on their personalities when they grow up? Is
And
this
I'll just add
is
another question. How difficult has it been for the parents also?
Hmm.
Yeah.
So I think it's been tough for everyone, as you rightly said, but my heart truly goes out to the children.
Hmm.
Because the thing is, I mean, yeah, unko kaun samjhayega? Who will tell a 2-year-old, yeah, you can't go out and
Yeah,
play in the
yeah,
mud? And
yeah.
I'm actually doing a study now, which is very technical, but okay.
नहीं
It's
नहीं,
just
बोलो
about
बोलो
the
बोलो
speed
बोलो
हाँ
बोलो
बताओ यार. हाँ.
बोलो.
speech of kids at 2 years and the amount of screen time they are having. And I'm finding that during the last 1 year, 33 to 35% children are having speech delay, and the average screen time of a 2-year-old is 3 to 4 hours. Whereas,
Yeah.
according to guidelines, less than 2 years should have no screen time. Now, people say COVID is mild in children, COVID is mild in children, but looking at these things, I really wonder, is it mild? And the maximum time for brain growth and development is till 5 years of age. So, is the long term impact, how much will it be? I don't know, it's difficult to say. And I'm seeing a lot of children losing milestones. So, I have a couple of kids who came to me, they were talking nicely, playing nicely.
Hmm.
Suddenly, schools are closed, just at home with parents.
Hmm.
Parents भी दोनों working हैं, they are doing their online whatever office or work from home. The child is given a tablet, just left like that. No grandparents around. Kids who used to talk have stopped talking, have stopped interacting because in their world there is no need to talk. No, the the cartoon characters are talking. Parents are
Hmm.
Yeah.
busy
Hmm.
on their
Hmm.
devices.
It is
So
all
yes,
it is all passive download,
definitely.
huh?
Yes, and the rate of obesity is increasing very fast. Like kids are becoming so obese. Like from their last year visit to this year visit, I find like a sharp gain in their weight, and most parents are taking it very lightly. They feel okay, once Corona is over, they will start going out, they will start playing. But I don't know. Childhood obesity is a factor to
Yeah.
adult obesity.
Yes, it is. We can both testify to
But
that. We
Indian
can both
families में वो नहीं
testify.
होता, पतला बच्चा है ना तो बहुत प्रॉब्लम होती है. The child is
हाँ, खाते पीते खानदान का नहीं लगता ना फिर.
So I really feel we are heading to an epidemic of obesity if this is the way things continue.
So I understand where you're coming from, because in my profession as well, we try and get the kids to craft more. We try and get the kids to use their motor skills more. We try to reduce their screen time and involve more in creating stuff, in crafting, etc. I am facing the same resistance as far as parents are concerned over the last year and a half. I also agree to you that it is very difficult and to involve the child while you are also working at home. Your attention span is also diverted towards your office space. पहले तो स्कूल में छोड़ दिया, crèche में छोड़ दिया. अभी they are in your vicinity and you have to make sure that they don't disturb you while you are working, right? So working parents का यही mindset है कि हाँ मेरे को disturb नहीं करे meeting में, as long as that is happening, fair enough. Then option क्या है? How do we take away the screens from the kids? What are the avenues, or what are the relatively easily adoptable avenues that the parents these days can take?
See, there is no easy solution, I feel, but what I tell all my patients, parents also, is that only ki at least whenever, so some people have a very huge fear of corona, and which is not wrong. Like, say, I have been sending my daughter outside to play with a mask since a long time now. So I'm taking a slight risk. I know that. So if you're not willing to take the risk, then I tell them early mornings or say slightly afternoon times when there are no kids out. That time you go out with the child, go for a stroll, go for a cycle ride. You exercise with them or you dance with them. Just if you really you can put on some music or dance, or at least if you're giving screen time, you can do something more creative like a Zumba class, dance class, yoga class. Like there are lots of online classes, so do something which involves some activity. I think that thing needs to come from the whole family. So something like that probably we can have, but it's important. Kids need to go out. There is no option to that. You have to find out the time to take your child out, and maybe let them make a mess. Let the house be messy. You don't care about a messy house. At least your child's brain will be wired right. So give them paints, give them colors, crafting sets. So, and kids love messy stuff, which parents don't like. So,
Slime as well, yeah. I will
yeah.
never understand what the kids like in slime.
Oh, I am sitting in my daughter's room. I should find slime somewhere lying around. So, yeah, I know. What is the fascination? I don't know about that. So I'll ask both of you a question. What about all these apps, these Byjus and Vedantus, and if I said the name correct? So I think that's more related to your field. Do they really help? I find so a lot of kids going for these apps. Is it added pressure? As a pediatrician, I was trying to understand it. Is it correct, or is it putting extra undue pressure on the kids?
Vishu, from your experience as a parent, would you like to answer that?
So the bubble that I live in, there has been a very negative publicity of all these apps, Byju Whitehat Jnr. Although they are doing huge businesses,
I know everybody's taking it.
Yeah. So, but like in the LinkedIn space, everyone is criticizing them because the marketing strategies that they use to sell it to parents, like they are trying to tap the insecurities of parents. कि हाँ मेरा बेटा अभी अगर 3 साल से ही कोडिंग करने लग जाए तो 12 साल में वो करोड़पति बन जाएगा. So what the app, those apps, the effect that they have, मैं comment नहीं कर सकता. I feel that थोड़ा positive तो हो गई. At least they are doing something. जो वो अगर नहीं होता उनके पास तो वो कुछ भी नहीं कर रहे होते. So
you can look at it. You can look at it from two angles. One is the business angle, and one is the actual product value angle. And I feel that they are doing well on both the counts. Their business seem to get their subscriber base as high as possible. Now, are the means that they are adopting ethical? No. Are the ways that they're treating their team itself, are they ethical? Not at all.
No.
But are they getting shit done? Yes.
Yes.
Are they getting the subscriber base where they want it to be? Yes. Do they have India's most marketable man as their brand ambassador? Yes. Are they spending big money in getting the early adopters on board? Are they spending big money? Yes. Now coming to the product angle, the parents of our generation, people who are similar to my age, don't have a lot of trust in the Indian traditional education system. they have gone through it themselves, but they don't really think that it was the best education that they could have had. They always aspire towards the Western style of education, which is experiential learning, which is learning by doing again, not rote learning. So, if anything, if there is anything attractive in the market, which is offering something different to the age-old system of books se ratta marna or paper mein ulti karke aana, if there is anything different, they will be attracted to it. And is it offering something different? Yes. The level of animation, the quality of content is genuinely good.
I haven't seen the product, and I don't know. I think the effects of this type of learning are yet to be seen. कि तुम्हारा screen time तो बढ़ ही रहा है. So
No, I'm not
as
talking
Dr.
about the
Sharma said,
effects. I'm not talking about the effects of learning. I'm
yeah.
only
So they have been pretty good. Like the companies have been pretty good at what they are doing, but I don't know what effect that will have on the children. The
I am
brain का wiring,
100%
yeah.
sure that it will not have a great impact here. I am 100% sure.
Yeah.
Because eventually it is passive learning. Eventually it is passive learning, and
Yeah.
your brain develops better if you indulge in active learning. ये तो मतलब studies have shown. It is definitely not going to be as good as if you do extracurricular activity. It is not obviously not going to be better than that. But as far as the core product offering is concerned, is it better than the bookish knowledge that is being taught in 80% of the schools today? Yes.
मेरे को ये भी एक डाउट है. मे बी वी आर लिविंग इन द प्रेजेंट टाइम्स वेयर वी डोंट यूज स्क्रीन्स as much as we would be
Really?
using in the future
अच्छा.
like not all professions. So I don't know, मतलब अभी हमको like children using screens or spending time on screens, it is frowned upon. So I really don't know whether it will be beneficial कि जितना जल्दी तुम screen से used to हो जाओ, maybe future में वो beneficial रहे.
Maybe
I really don't know.
फ्यूचर तो
मतलब
ये भी हो सकता है कि फ्यूचर में स्क्रीन्स खत्म हो जाए तुम्हारे सब कुछ यहाँ पे अंदर, और यू आर प्रोजेक्टिंग एवरीथिंग.
हाँ यार, Elon Musk,
ट्राई तो वही कर रहा है.
Neuralink. नहीं, he has done something. So there is a news that has put
वो
Neuralink chip.
symbiotic
No,
system वाला ना.
he's put a chip, a chip in a chimpanzee, and that chimpanzee could play a game using just his mind.
Speaking of chimpanzees.
So future तो देखना बाकी है यार अभी.
Welcome to the final segment of our show, which we like to call slow takes. So it is exactly the opposite of what a rapid fire would be. Rapid fire में आपको quick snappy response देना है. इसमें आपको ऐसा कुछ नहीं. इसमें आपको thought out अच्छे से elaborate answer देना है. You've been in this profession for how long now?
So I entered my MD in 2006. So if you count from my MD days, so I've been a pediatrician. अभी कितने साल हो गए? 15 years. Oh my God! Now I feel old. Which I am. It is important in my profession to be old.
Nah, yes, correct.
Trust आता है.
In your experience of 15 long years, what is the weirdest interaction with a patient that you've had? Funniest, weirdest, craziest,
Dumbest,
psyched out, dumbest. What is the weirdest interaction that you can think of?
So I mean, there have been plenty, but lately a child came to me, and I was telling him he had gained a lot of weight. So I was telling his mother that I was telling him it is mandatory that you exercise. He was like, it is not mandatory, it is mandatory.
Oh.
I like how I Google
Oh my God.
pronounce. So kids these days are savage. They will just give it back to you. So yeah, that is one of them. And with parents, Indian parents somehow have this obsession. If they will say बच्चे को loose motions है, they have to follow it up with a pic. And I'm like, I don't want to see that. I understand it's loose motion. And once a patient came and Vishu is like totally grossed out. And once a patient was like, yesterday my child passed very weird color motion, loose tha, aisa color tha, waisa color tha. And she takes out a
polybag
sample.
polybag and puts a diaper in front of me in my table. So yeah, I guess that will rate number one.
Wow.
Nice.
Wow.
Okay.
तो फिर आपके क्या कमेंट्स थे उस पे कि हाँ इसका टेक्सचर ऐसा लग रहा है?
ये grade 4 लग रहा है मुझे.
No, they are not satisfied. If you tell them, no, I understand. No, I took a picture. And I don't want to see. I understand loose motions. So
And I'm just imagining your entire WhatsApp chat history would be filled like shit like this. WhatsApp images में
right after
जाके अगर
marriage,
देखोगे,
my husband by mistake once picked up my phone and he was like, that day he never even touches my phone. If I just pass my phone also, he's like, क्या दिख जाएगा पता नहीं कौन सा. So yeah, no,
nice.
that's the problem. What a shitty end.
Literally.
Yeah, okay.
Thank you so much, Dr. Sharma, for taking so much time out. It was an absolute pleasure speaking to you, and I hope you had fun speaking to us as well.
Absolutely.
Thank you, Dr.
Great
Sharma,
time.
for giving us all that
Yeah.
knowledge.
Yes, and hopefully COVID will end soon. That is the last thing I want
Yes.
to say. Yeah.